Good, everything looks good. How do you feel?
Fantastic, now that I'm here with you, because I know you're the best. So I flew in from Iowa just to see you.
Absolutely pleasure. And for doctors watching, seeing patients who are landing here from all over the world as I'm approaching them with their complications that they've come in with. And in between that, my own amazing patients on my Mona Lisas, I call them, they are flying back to me. She's my patient who 22 years ago, I've been doing this for 3 decades now, as you know, I'm over. My amniotic procedure for pterygium surgery, the no-stitch technique with a unique way in which I arranged the Tecnis conjunctiva and cornea, and she had a very aggressive pterygium right up to the center. Here she is 22 years later, still doing good. You've done this day one in the mirror when you go, you've seen all those things that I started way two decades ago. How do you feel about your eye till today?
Well, I saw two eye doctor within the last year. I didn't accept what they say, so I flew in to you. And then my fiance mother called and said he has cataract. I said, well, I'll be on the next plane. He has to go to my doctor, Dr. Gulani.
I see him, he's traveled here to do his surgery. And how do you feel about your pterygium? I did that 22 years ago in your right eye. And you can come forward, and you can see the eye, how it looks even today, 22 years later. Look straight ahead, please. There we go. This is the eye we did, and you can see the anatomy. Cornea is crystal clear, and she has actually flown in for now very advanced cataracts in her eye, and she's come down from Iowa, and we'll work on that with LaZrPlastique. Anything you want to say about your pterygium experience now that you're 22 years post-op?
Well, I haven't had a problem, and as you remember, once we started the surgery, you were surprised because it had a double root.
Yes.
And so we had to do extra hour in surgery because you didn't see that from outside until you got inside the procedure and started it.
Correct.
Yeah.
And again, you can see how amazing our patients are, how intelligent. Yes, there were many protocols I have built over the last 3 decades. She is a very important person among those patients which I did at that time when I set my protocols in motion, and I called it the iceberg concept, that what you see is the tip, you have to go down and get the roots, and that's the whole basis of the no-stitch sparkle technique for pterygium. And you remember, I started it with all of you actually, going up to the mirror day one after surgery. And
you were the first, not cutting you off. I was your first. The TV crew was there.
The news people, yes.
Yes. With their surgery. And what impressed me, I didn't meet you until that Saturday night, and the surgery was that Monday.
Correct.
You called me at 7:30, and I'm like, who is this? And you explained the procedure if I would go along with it.
Correct.
And I was like, a doctor at 7:30 in the night? Yes, I'll go with you. Because the other 2 doctors told me when I had the surgery, I would lose the sight for at least a month or so. But that didn't occur with you.
Pleasure. And she's stayed clear since then, sparkling white eyes, clear cornea. That also gives me confidence now, 20 years later, 22 years later, to perform a premium lens cataract surgery on her and bring her to excellent vision. And thanks for your trust, Ingrid.
Thank you.
It's been an honor, absolutely an honor, a privilege.
Also my privilege to meet you.
Thank you. And I'm doing your granddaughter's surgery too.
You're now 3 generations. You did my daughter.
Jessica, remember? Dentist, yes. And then
now you're going to do my granddaughter.
First I'm doing
only 1 year old
when
I
did your
my surgery.
And I'm doing her fiance.
Yes.
Day after tomorrow. LaZrPlastique, premium cataract surgery, and then you will do, so 3 generations.
Yes.
And all 3 different surgeries.
Yes.
LaZrPlastique, pterygium. For your granddaughter, I'm doing LaZrPlastique, my no-cut LASIK technique. We'll do it. Take care, guys.